Hello, my name is George Chen, and today I would like to talk about my paper titled Deep Kernel Survival Analysis and Subject-Specific Survival Time Prediction Intervals. First off, kernel survival analysis methods predict time-to-event outcomes such as time until death using what's called a kernel function, which specifies how similar any two patients are. For example, for a test patient, we can use the kernel function to find who the most similar training patients are for whom we know the survival outcomes for, and using the information from these most similar training patients, we can make a prediction for the test patient, such as in this case, 30 years until death. An appealing thing about kernel survival analysis methods is that for any prediction, we can always find who these most similar training patients are, and they're driving the prediction, and you can think of these most similar training patients as forecast evidence. A challenge to using kernel survival analysis methods is that we have to specify what the kernel function is. And what this function should be depends on, for example, what disease you're looking at. If you're looking at a disease that is gender specific, then your kernel function should heavily weight gender in defining similarity. As another example, if we're looking at COVID, certain patient attributes should be weighted more, such as age and immunodeficiency. As the first major contribution of this paper, we show how to automatically learn such kernel functions in a neural net framework. The second part of this paper is about how to put error bars to a prediction such as 30 years until death. So this leads us to what are called survival time prediction intervals, which look something like this. We might predict that a test patient has 90% chance of death in 30 plus or minus 10 years. So here, there's a question of, well, what do you mean by 90% chance? So this could be 90% across patients who show up at the hospital. This would be what we call marginal coverage. However, if you're the test patient, you probably would want something that's more like 90% chance across patients who are similar to you. So this leads us to a different notion of coverage that's called local coverage. And this depends on some notion of similarity, which ties back to kernel functions. So as the second major contribution of this paper, we show how to construct survival time prediction intervals that have both marginal coverage and separately how to construct these intervals to have local coverage. So just to summarize the experimental findings, I'll say that our deep kernel survival analysis estimators have accuracy that's competitive with DeepNet baselines. And also with our prediction intervals, if you look at the interval widths, this turns out to be you can use these widths as a new performance metric for benchmarking survival analysis methods, where narrower widths are better. And in particular, we find that our deep kernel survival analysis methods achieve highly competitive interval widths compared to all the baselines. Thanks for listening. If you're interested in hearing more, please swing by my poster.